Hello, my name is Fabianna and this is my urinary catheter insertion skill validation video. So I'm going to go ahead and start out by verifying the doctor's order, and I'm going to assess for the procedure's need. And I'm going to explain the procedure to the patient just to make sure that they have, if they have any questions, explain the adverse reactions, and just to understand that they fully understand exactly what it is. And I'm going to verify the allergy status of the patient. I'm also going to verify the patient with 2 identifiers. I'm going to ensure patient privacy and safety, and I'm going to go ahead and start. So when I do start, I'm going to go ahead and walk to the patient, and I'm going to just place the supplies at the bedside, and I'm going to spread the patient's legs and ankles. I'm going to make sure that they're in a comfortable position, and I'm going to place the bath blanket under their back. And then I'm going to go ahead and start opening my Foley kit. Okay, so I'm going to bring this down just a little bit here. All right, so after that, I'm going to go ahead and once I've opened my Foley kit, I'm going to open this drape, and I'm going to place this between the patient's thighs. Okay, forgive me, I don't have a large space. So let's just imagine this was a huge bed. Okay, and after that, I'm going to go ahead and don my sterile gloves. So make sure that I'm using sterile technique here with this glove. I'm going to get my other glove. I'm going to put this glove on. Okay. So after I have put on my gloves, I'm going to go ahead and open my antiseptic solution, and I'm going to pour this on my cotton balls like this. And after that, I'm going to open my lubricant, and I'm going to prepare my lubricant on my tray like this. And after I've prepared my lubricant, I'm going to go ahead and attach my pre-filled syringe to the catheter's balloon port right here. Make sure that I attach that here. Okay, and after that, I'm going to go ahead and assess it for cleaning. And I'm going to grab my non-dominant hand and spread the labia minora, exposing the meatus. And when I'm doing this, I'm going to make sure after I'm doing this, I'm going to go ahead and make sure that when I do grab the cotton balls and I'm going to start cleaning, I'm going to clean the labia furthest away from me first, and then work towards the one closest to me. And with each cotton ball, I'm going to go ahead and use a top to bottom motion, and I'm going to repeat this procedure until I run out of cotton balls. And I'm also going to do front to back in the middle area. So I'm going to start like this. And I'm going to make sure that I dispose of my supplies, not crossing sterile field. And I'm going to repeat this. Okay. And I'm going to dispose of that. And then after that, I'm still going to have my non-dominant hand exposing the urethra, and I'm going to start by lubricating my catheter tip here. So I'm going to remove this wrapper, dispose of it right here, and I'm going to lubricate the tip of the catheter on my tray where I prepared my lubricant. And then I'm going to start the insertion, and when I start inserting here, I'm going to make sure that I'm advancing until I see urine. And once I see urine, I'm going to make sure that I advance 1 to 2 inches more. Okay, so then I can get my non-dominant hand and hold the catheter on this side. All right, so then after I've done this, I'm going to inflate my balloon with my pre-filled syringe. And I'm going to make sure that I'm inserting it. And I'm going to dispose of my pre-filled syringe once I've inflated the balloon. Okay, and then after that, I can gently pull on the catheter just to make sure that it's in a good placement. And after that, I'm going to attach the catheter to the patient's thigh to make sure that it's holding still. And after that, I'm going to go ahead and move the balloon port to a non-movable piece of the bed, and that's where I'm going to place the balloon. So here, forgive me for all the moving. Okay. All right. So then after that, if I do want to grab a specimen of urine and it's in the order, I'm going to grab a syringe and I'm going to access the syringe port right here, and I'm going to grab a specimen of urine if necessary. And that's how I'm going to go ahead and grab a specimen of urine. I'm going to put it in the syringe. I'm going to put it in my specimen cup and then dispose of the supply. And then after that, I'm going to go ahead and adjust my patient's gown, adjust their drapes, remove this drape and adjust the bath blanket. I can take it away now. I'm going to go dispose of all the supplies that I use that is now garbage. And I can go ahead and remove my gloves. And I can remove this from the patient's bed. And throw this out. Okay, and after that I should be done and my patient should be comfortable. I should make sure that I bring the bed to an appropriate height, make sure the appropriate bed rails are up, ensure patient privacy, and I'm going to make sure that all the safety precautions are intact, and it should be okay.